As the sun rises, so does the promise of better healthcare for all. People of the Western, North, and Central regions have seen the fulfillment of this promise. In this episode, we take a trip to the coastal regions and discover the impact of these projects.
Prior to the establishment of these polyclinics, the communities in these areas were served mainly by either CHIPS or health centers, and cases were routinely referred, to other places. It could be Fianquanta or some of the major hospitals. And in health, every second counts. So it's so important that now we don't make unnecessary referrals, let me put it this way, or avoidable referrals, because there are doctors there, there are other staff there, we have the equipment, state-of-the-art equipment. They're able to manage most cases which were hitherto referred to other places. And of course, we do this in conjunction with other partners, the National Ambulance Service, and then others as well. So for health in the Western region, I think is moving forward, and we are very grateful to the government.
For our hospital, which is the main referral hospital in the region, we do not less than 100,000 OPD cases per annum and not less than 15,000 inpatient annually. So that's the kind of figure that we are looking at.
The Fianquanta Regional Hospital stands as a beacon of progress. The new facility of 350 beds brings the total capacity of the hospital to 550. Dr. Joseph Tambil, the medical director, shares the remarkable advancements at this facility.
Fianquanta is a very old hospital, started in 1938. It's gone through several stages of development, but I must say that this is the biggest and most comprehensive addition of services or redevelopment, if you may call it, that is happening in the life of the institution. So we are excited. Our clients are excited.
On the Fianquanta, what we had to do was to demolish certain sections that were not good enough. It sits on a plateau like that, and we needed to make good use of the usable land. So that's what we did at the Fianquanta, and it's coming up so well. That one, we have the modalities for all imaging: X-ray, CT scan, MRI, fluoroscopy, mammography, all the modalities that you can think about, they are in there. Beyond that, when you go into the pharmacy area, they have the production unit, which now supports the dispensing unit, which is fantastic on its own. As I said, the number of beds, 350, coming to add on to the new one, also makes it a good one there. Accident and emergency, brand new. In terms of the accident and emergency section, it was spec to the highest point that we have. And then the good thing is that for planning purposes, the imaging, accident and emergency laboratory, they are closely linked so that in terms of the functional flow, everything happens. And then I think we also have a place for oncology, where you treat cancer people, and then the dialysis machines are also in there as well. And beyond that, you have the inpatient section where for people that cannot go home, they are kept there. So it's I think about a 6-story, facility, which is very huge. Yeah. Level of completion now, in terms of the civil structural works, we are around 70%.
A research lab is also under construction, further enhancing the hospital's capabilities.
Now I'm the president 2016. Now honorable Bobo ordinary bar Fia Quanta no mission nurses. No better small can renovate a haka crab. Your bosom man. The president now called there no journal. Not pressure the man. No, the no. It's a hospital. What's in the Casepreco? na ha oyɛ teaching hospital so that obi yare wɔ Western region yɛmfa no nkɔ Cape Coast anankra yi de hwɛ dwuma kakra wɔ ya ɔyɛ aba na ɔyɛ committed to Western region na ɔbɛyɛ dɛm ade no na what's the government sabi government nti ami de megye dipa de sisia baby yedri na bibia project yedri ese de yewi na yebewi so a ɔyɛ aba na ɔsabi arada aba na ɔbɛyɛ dɛm adwuma no Western region ya so as fertilizer na na de aba no ɔyɛ nkoko 12 am de bia meka minister no le bi wakɔhwɛ bi fɛfɛfɛfɛfɛfɛfɛ nti megye de aba na ɔle yɛ ade papa de no ɔna ɛso no do ɔsi nimpa ɔle food aba no na epia impia de mabani because government sabi government.
In Bogoso, the polyclinic there has transformed healthcare delivery.
Since the creation of this municipality and being the municipal capital, we only had this health center which is close to the market, which is limited to healthcare services. No surgeries and other complicated issues staffs couldn't handle. So all that they needed to do is just to be referring all clients, especially the maternal and child health, to nearby municipality. So the coming of this polyclinic has really been a very big relief to the entire people of the municipality. And at least health workers here have also gotten a relief that when there are such emergencies, we also have a place that we can send this emergency to.
Bogoso na yensu yenya hospital a eti sei ebe wo wa ha na kakra me kan say hospital we oma ho fama ni omu bibia kamanese fo wa abotre ni bibia nti say ye pese ye keeping it safe eboa ye nyina ye yetememufo no na we say ye hwesu yie na aboa ye chirimba eni Bogoso man nyina.
So we want to say or stand on behalf of the entire people of the Prestea Wini Valley municipality and say a very big thank to the government for bringing this edifice to our municipality. The happiness on the faces of people cannot be overemphasized. We only say thank you and say Ayiko.
At the Nsawam Government Hospital, the gap in health inequality has been visibly bridged. Francis Oforiata is head of administration.
We are also delighted because it is very much easy to work in a new facility with all the equipment and all other medical items that a health officer needs to function. So we are very much grateful to the government and we are also very happy and we continue to render the quality care delivery that we are all yearning for.
Baby, I are fine. And I send you more about so on Kola, send you a more show on also, and you see you good. And the son can make a crank, maybe me feel no clinic in war. By sending a beer has sent me feel some bar. On bet me, I shall be fine, my minute, and I'm in a buy and see how to be beyond say, fine. And I say, when you are my because so I may be say I'm fine, my own has say, and can be because a bit to tell me, grand quanta, this school, and yeah, dear bets upon that in Nano, I mean, be say what I say.
And in Alubo, the new hospital has solved the problem of geographical access, with services now benefiting people even across the border in Côte d'Ivoire.
Before the inception of the hospital, people of this community were traveling far away to either Hafasni or Ekwe to seek health services. Since the hospital came, they now come here. So the journey that they make, that long journey that they make to Hafasni or Ekwe, is now a thing of the past. And beyond that, even people beyond the border, Côte d'Ivoire, we are at the border. they also benefit a lot because they cross the border and come and access health services here. Okay, the equipment in the hospital, I would say they are state of the art. As if you go to our NICU, we have modern incubators. You go to our theater, all the machines you see there are new machines. And for the first time, I've even come to see a machine that sanitizes the air in the theater. And it's state of the art. Then if you go to the maternity, their delivery beds are also new ones, state of the art.
The additional facilities at Wassa Dunkwao and the upgrade of the Mpoho Government Hospital has further extended healthcare services, reducing referrals.
We've been to our 3 facilities. Okay, we've been to the Lubo Polyclinic or Government Hospital. We've also been to Shuaim, and here we are at the Municipal Hospital. I'm also happy to mention that out of the 3 facilities that we've visited, 2 are new facilities that were started and completed under President Nana Addo Dankwa Akufo-Addo. It is important for us to appreciate this fact that a lot of resources have been invested into our healthcare system. And the president has done well to make sure that every corner of this country also takes part in this investment. It shouldn't be only Accra, Kumasi. And I'm happy that Elubu, which is just about 7 minutes drive from the border in the Ivory Coast, has also experienced these investments. This Elubu facility, together with Inshuaim, the one at Bokoso, and Mpoho, and the rest, are 6 facilities in a package that cost about 29 million euros that were procured under President Akufo-Addo in 2018. And the project started in 2019, and I'm happy that they've seen the light of day. I'm also happy that when we visited this place, the administrator for the Apinto Hospital made us understand that they've received some items as part of a retooling effort by government. A 3D ultrasound machine, a 4D ultrasound machine, as well as a digital X-ray. We are working hard to make sure that every corner of this hospital, there is some investment when it comes to capital infrastructure. Once we create the right environment, there's a greater chance that patients will get the best care. And we are not focusing only on equipment environment, but the people who work in our hospitals.
We have also attended to so many maternal cases, some of which come in emergencies, some come up at night, and if this facility has not been in operation, some of us could guess that they could end up somewhere which would not be the best. So this facility has come to help the population, and it is serving the population. Currently, we have on average OPD case of around 500. So you can imagine when this facility hasn't been established, all these people who are coming from especially the rural communities will have to seek health care elsewhere. And so we are grateful to the government for giving Wassa Dunkwao and its community, surrounding the communities, this nice edifice, which is serving the health needs of the populations.
And in the Western North region, the new hospital in Sefia Kontombra has brought great relief and transforming healthcare delivery. The combined capacity across all 5 hospitals comes to 550 beds, a major milestone in healthcare infrastructure. At Seshi Asawinso, the Queen Mother pledges to ensure the facility is properly maintained. She, however, recounts the difficulty in accessing healthcare, especially during the rainy season.
wobɛkɔ na hɔ nyinaa yɛ nsuo ɛhɔ ayɛ basaa na yɛnya bi wɔ ha ne deɛ ɛboa yɛ ankasa ɛbɛboa yɛ yɛde yɛni agye ankasa ɛyɛ ma yɛn wode toto bebree ho de agye sɛ ɛma wei ho koraa ɔmo ayɛ ade aban ayɛ ade ama yɛ
mede kakra bɛka sɛ yɛda aban no ase ɛwɔ mboa kɛse wɔde aboa sansoman ne saa community na atwa ahyia no because ɔmo hyɛ bɔ sɛ ɔmo ba bɛyɛ ama yɛ ɛna aban bɔhyɛ no so ɔmo hyɛ no so no ɔmo adi so nti yɛda ɔmo ase.
Let's take a trip down to the Central Region. In Cape Coast, CEO of the Cape Coast Teaching Hospital, Eric Kofi Jedu, says the treatment center provides an additional space to manage the growing patient numbers and supports the training mandate as a teaching hospital.
Originally, it was built as a holding center to hold COVID patients. If you recall, in 2019, the ministry instructed us to, as it were, collapse our polyclinic, which was used for outpatient services, and then convert it into a holding center. What it meant is that primary healthcare delivery within this enclave was compromised, and that is why this COVID treatment center was built to replace it. But fortunately, there's no COVID. So a portion of this center is going to be utilized for infectious diseases, as the other spaces will be utilized to augment on the scope of services of the institution.
The staff are delighted with the new facilities, and the feedback from residents has been very positive.
Maybe I make facilities na ban why ade de why bibi o teta mo hanom oda aboa ayarofo na kuro na la hwehwe ye woman or ye kepu sikru oda aboa papa.
A lot has been done. I will start with the recruitment of staff. So that's one area. The next is equipment delivery. I would also talk about a new oxygen plant that is coming up. We wish government, everybody who's been part of the upward journey of Efia Nkwanta, all the best. And we pray that the good Lord himself would bless all of us.
Thank you. This heavy investment in health, and then of course, we can also speak for education as well. These are very critical. And healthy nation is required for any meaningful development. And I think the government has made a lot of investment in this area.
The investment in health infrastructure in the Western, North and Central regions demonstrates government's commitment to improving healthcare access and quality for all Ghanaians. These developments not only provide immediate benefits, but also lay the foundation for a healthier future.